Good morning, good afternoon, good evening. Welcome to another episode of Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
We are hoping that you're having a great August, and thank you so much for tuning into this special episode.
Yes, we have a special guest on our podcast today for you guys, and we have a cardiac sonographer here. Her name is Evie, and she's based out in Chicago, and she's here to tell you guys all about her journey to becoming a sonographer and just kind of like why she became an ultrasound technologist, and just so you guys can see what it's like to be a cardiac sonographer. Obviously, Lynn is a student. Now we have a sonographer here with us. So we're really excited to have you on the podcast so you can give us all your insight and maybe some tips and tricks for all the students and for Lynn, since she's about to be a sonographer. Welcome.
Welcome.
Hi, thank you for having me.
Yes, thank you so much for being on our podcast. Truly appreciate you taking the time out of your day. And we just want to hear your story and see what you want to let everyone know about your background and why you chose ultrasound.
Sure. So my name is Evie. I'm a cardiac sonographer for about 2 years now. I passed my registry last year, and I'm trying to think. I think it was April because it was sunny when I passed. Very happy day. Before that, I was a medical assistant in ophthalmology. So it's kind of like a different field from eyes to the heart. And prior to that, I was a nursing student, but it didn't work out. So I dropped out of nursing school and I got hired as an ophthalmology technician. I got certified, but I was not fulfilled in medical field. So I started digging and didn't want to go for nursing. So I found cardiac sonography. So I became friends with the technologist at our location. He walked me through a lot of insights, what it is. And then at that time, there was a girl who was his student. And she was in the school, which I also graduated from, called Washburn University. The program was very untraditional because it was a 1-year online certificate program. The school is PHEP certified. It's a little tough school because it was 12 months of clinicals, about 3-4 days a week, depending on everyone's situation. And then we had 4 classes per quarter because there were about 3 quarters. So we had some introductory classes. But prior to that, I had to take some prerequisite classes. So like for every program that's out there, I had to do the same thing, biology, chemistry, medical, terminology, I think it was. And I have a bachelor's degree already. So everything that I had transferred over, and I was able to start the program. The program is a little different because it would take students that are already somehow established in medical field. So either nurses or at the LPN, which is the licensed practitioner nurse, respiratory therapist, anybody that has like some type of certification with at least associate's degree, because they offer just a certificate in sonography. So I got accepted. Mm-hmm. And my previous job site, I had to quit my job and take the clinicals. So I was able to do my clinicals at the hospital because I work at the outpatient center. So I had to move to the hospital site, which was a little further north from what it was. It was just fun. I never had any labs. They had to teach me from scratch patients. So I did inpatients only throughout my whole clinical career. And I've seen a lot of different cases. I remember my very first day, they took me out to outpatient's room and then they said, oh yeah, let's go and see a transesophageal echo. And I thought, okay, I don't know what that is, but let's go and see it. So I went there, and as the doctor was working with the probe down the throat, the patient started to code. And they said, go get the nurse, the patient's coding. And that was it. I was like, okay, this is awesome.
Wow.
Yeah. So I got the nurse, they went over and I saw them performing CPR on the patient. They got the patient back, but they didn't finish the echo. But yeah, that was just like a lot of instances like that as a student. I saw patients falling, we had to pick them up. So mainly my experience was inpatients. Some outpatients were out there too. That's why maybe I don't like outpatients that much.
Wow. We were just on our last episode, actually, we were just talking about that inpatient versus outpatient. And it's quite interesting to hear that too, because Lynn also prefers hospital setting as well.
You have more time because outpatients, you have 60 minutes to perform an echo. So you have to be very efficient and you have to know your protocol and your windows, that there's no like room for error. With inpatients, it's kind of like, okay, you go to the room, the nurse will help you position the patient, which I had today. I do help my nurses with positioning. And then you just do whatever you have to do. Sometimes people just walk in and disturb you because they want to talk to the patient. So you have more time, I feel like, and you can just relax with the patient. And a lot of the patients are intubated too. So unfortunately to them, they are not aware sometimes of what's going on. So you just kind of, I mean, you have to talk to them sometimes. But I feel like you also learn more. You see more pathologies in the hospital and inpatient setting. And that's why I like it better.
That's awesome. Lynn, how does this make you feel hearing it from the other side?
I'm just in awe. I'm just listening. It's like, when you mentioned about TE, I thought of Giselle because she once asked me about TE. I was like, Giselle, this is the perfect person to answer your questions.
I know when she said that. And then she said that they coded. And I'm like, oh no.
Yeah. You're not gonna. Yeah.
Well, my doctor wants me to get a TEE. So that's why I asked Lynn. And then, because I've never, obviously I'm a general sonographer, so I didn't even know that you guys did that. So that's kind of cool to know that you got to see all of that. Obviously you had medical background, but you get to see those kinds of things. And people think that being a sonographer is so easy. And I think it's so far from that.
It is. And I remember at my clinical site, my preceptor said, oh, yeah, we just make it easy. We make it look easy. So the patients are like, oh, your job is easy. I'm like, yeah, no, it's not. you just make it look easy because you need to be efficient and you need to find whatever is going on with the patient.
Right.
But no, even we at my current place, we do teach fellows doctors. They come for a whole day with us, and then I do my scan, I do my patient. It's usually during the outpatient time. And then when I have a little bit of window, like let's say 10, 15 minutes, I will help them find their parasternal, apicals, and subcostals, because they are learning how to kind of look for effusions or anything, that's wrong with the heart, because they do go in and they take a little peek at the patient's heart first before they even call us, if it's emergent or if it's something that can wait till the next day, which is really nice. That's why we kind of teach them and put our hands on that. We say like we have to be nice and good with scanning.
Yeah.
So what has been like the toughest part about being a cardiac sonographer? Because you said this, like you make it look like easy, but it's actually not.
I think the first thing when I started working as a sonographer at my first job, it was the outpatient when I was kind of slow, and kind of like talking to patients too, trying to explain to them and make it look that I know what I'm doing, even though I know what I was doing. Learning how to use contrast. Either there's like 3 different types that you will probably learn and do later, but just to get more efficient with it, and then sometimes you have patients that are not compliant. They just don't want to do anything. They don't want to move. And I would say it's a little tough because you're trying to get that window, but you can't. They kind of like say that they're hurting and you're trying not to hurt them. Or you have patients that are they say, no, I don't want to do anything. And then I sit there and I don't know what to do because I do want to help them and I can't. So I would say that probably. And my struggle was to get the perfect window, but I just listened to your last podcast and I agree with, I can't remember who that was. It's not about the perfection, it's about the diagnostic picture.
Mm-hmm.
So as long as it's diagnostic and it's good and what you see and you're 100% sure that this is what you see, the doctor will see it too, you're good. You don't have to go and be like, oh my God, I have to have that textbook picture because otherwise, it's not going to work.
Yeah, I
think that's hard.
I like that you bring that up though, because a lot of times the toughest part doesn't have anything to do with you as a scanner. You know what you're doing and you know what windows you're supposed to get, but how can you get those when there's other factors that aren't in your control? And that doesn't make you any less of a sonographer. That's just the forces that are up against you. And now you have to try to figure out, okay, now what do I do in this situation? How do I get that diagnostic image, even though this patient doesn't want to turn on their side for me? And it's the same thing for us in ultrasound and like general, where we have to look at the pelvis, but the patient won't let me, scan them. Or legs, which I'm sure. Do you do vascular too, or no? Just cardiac?
No, I'm interested, but I just do cardiac.
Cardiac. So in legs, there are some patients who don't want to lay on their back, and I have to try to get the medial part of their leg, but their legs are together and they're turned. So I do what I can, right? And we all do what we can, and I love that you mentioned that because, like I said, it doesn't make you any less of a sonographer. You know what you're doing. It's just hard to get those images. That is very tough for us, right? Because we are also very much so perfectionists, and we're taught. Taught to.
And I did have a patient today. It was for LVAD. It's a long patient that actually is a long-standing patient there, and I had to check the LVAD and the RV function. I wanted to use contrast, but the nurse said that there is no IV available for the patient. And I'm like, what do I do? But then you try to get the best picture. You try to show the doctor, okay, this is what I got. And then you go from every single, view possible just to get it. And then you explain yourself, hey, sorry, I couldn't get it. And most of the time the doctors are understanding because they know the situation. Then they know the patient is kind of tough, or they're intubated, or it's just the body habitus or any other factors. So as long as you work with good doctors, you're fine.
Yeah. I love that. Thank you.
That's so comforting to hear because my biggest struggle in clinicals is trying to be okay with my images not being perfect, because in labs, we scan on our classmates and who have perfect anatomies because we're young and we're healthy. There's no pathologies. So that's very comforting to hear. And I'm sure it is comforting for students who are watching this and listening to this.
Yes. I'm trying to think of I really had patients today. I can kind of feel it already. Trying to think. I had LVAD patients, and then we did someone for a bubble study for PFO. There was a person, young person, came in with left eye vision loss, and we just had to do bubble study. So we learn how to do bubble study ourselves, which I never thought you can do, but you actually can. You just have to have a cooperative patient, and the IV line should be as close to you as possible. We always try to check the IV if it's fine, if I need to press on the site or not. Most of the time not, but if it doesn't work and you need a second person, then call them. So I did, and we showed a little bit of bubbles on the other side.
Oh, that's cool.
That's cool.
I love bubbles. I can always scream, oh, bubbles.
Me too. Have you seen Finding Nemo? I do the bubbles every time I see
that's funny.
People outside when they're blowing bubbles. I was like, bubbles. That's just a All right. So since you shared with us the most challenging or a difficult part of being a cardiac sonographer, what about your favorite part or a favorite memory that you have,
I
if you have any?
I'm trying to think if I have any. One time I would say a couple of months ago, I was inpatient scanning again, running portable, and I went to see this patient, and she could not talk because of the trach that she had, but she was able to write something down. And I remember and you can see it on my stories too. She wrote me a note, and she said that I was fabulous, which was really
That's so sweet.
sweet. It's like fulfilling. Oh, I did great. She didn't complain of anything. It just, it helped her. Another great part is that you see cool things. You see different pathologies, like you said. I just started doing stress tests on treadmill and dobutamines about
Nice.
a month, not even a month ago. I'd say 3 weeks now. They're amazing. Oh my God, my eyes are just always like opening. And the funny thing is, I do have a lot of positives. My coworkers always say like, "Oh, how do you get so many positives?" And I don't know. I just walk in and the patients are coming in, and they have positive stress echoes, and it's great because you see the problem, you report it prior to stressing them, and either they will get stressed or not. A few times we admitted a few patients. One time I remember this gentleman was just stressed out after he was by himself and no family members. And I came up to him, "You'll be fine. You're in good hands," kind of. You reassure the patients so that they're in good hands because they're all scared and don't know what's going on too.
Mm-hmm.
So the people-patient interaction. I like older patients too for some reason. I don't know if it's because that was my upbringing back in Poland. My mom used to tell us to talk to elderly neighbors, spend some time with them because you will learn how to respect them, and kind of they will teach you some the goodness of life, because they're so appreciative.
Yeah.
So yeah, kind of maybe that's why I like the older generation too, and they always have stories.
Oh yeah, I
That's all.
love
I
athletes.
like their stories.
Yeah.
Mhm.
They have great stories. And I mean, especially for you guys with Echo, now, do you guys get to talk to your patients during your scan? Is it okay? Or do you like it when they don't talk? Like,
I think it depends. If the image is fine, I would have a little conversation. But if as soon as I see the heart is swinging back and forth and the breathing is irregular, I say that I'm sorry, we can have a conversation. I would talk to them when I'm switching from one side. Let's say I finished a personal, that I go to the apical. We started talking about something. I will go back just to kind of make them feel comfortable. And I play music in my room. We're able to play Spotify or something mellow just to relax them, because I do have occasionally patients that are very nervous. They don't know what to expect. They're scared that it's going to hurt them. So I play music, and a few times patients just came out really relaxed, and they said it's almost like a spa
yeah,
for them.
so you
Mhm.
do your best to make your patients comfortable. And obviously we already know, being in the medical field, it's hard to be a
Mhm.
patient, and they're scared and they don't know what's happening. So it's nice that you get to provide that for them.
I do try my best. And then I think I'm working also with a great team. We do support each other. We have a communication system by texting. So we created a whole group, and then whatever we need, we'll text each other in that group. Someone needs help with bubbles, or someone needs something else, or patient needs something, you just say it and we'll do it. Or even with orders, whoever is portable, we have this extra phone. And then if I'm doing a patient and I can't get into that stat echo, I would ask someone in the group, "Hey, do you have time to go in and take care of that echo?" And then usually someone is available. I would say like 90% of the time, unless we have 30 echoes to do.
Ooh,
It's
busy.
kind of hard. There are days when we
How
had
many do you do in a day?
so I work 8 hours, and it's about 6 to 7 echoes. And it's Monday to Friday. I did a 10-hour shift before, so it was just random days off. So during the 10, we did 9, just depending on the day too. So, but I think I prefer the 8-hour days, so I can enjoy the evening sometimes.
Yeah.
That's
So,
interesting.
you do
Mhm.
5/8 in the hospital setting?
Mhm.
Okay.
So we start at 6:45 and we're done around 3:30.
Oh,
Oh,
that's nice.
yes, that is very nice.
I mean, it is 5 days because I work, well, right now I work 3/12s, but our hospital does
Mm.
4/10s. So,
Okay.
but 5/8 and starting at that time and getting up that time, that's not bad.
It's not bad. It's actually
Yeah.
pretty nice. I mean, I'm home usually around 4:30. Unless I stay longer, I do stay sometimes overtime. So I would leave around 4 o'clock or 4:30, and I'll get home obviously a little bit later. It takes me about an hour. Sorry, my dog is
Oh,
barking.
it's
It
okay.
takes me about an hour to travel. So, but it's not that bad. I can't complain or anything. We do get the call days, like I told you before. This is my
Mhm.
last day of the 8-day straight call.
That's crazy.
The call starts at 5 o'clock and it runs until 6 o'clock the next day.
Do they call you
So,
often?
knock on wood, no.
To say, I actually was asking Lynn if they did call at her place. So I was curious if Echo did call because I didn't know if they did or not.
Mhm.
And so they do.
I had days, I would say 6 months ago, that I would be called in almost every 2 weeks, which, just pack and go and do your stuff, but then it just kind of quieted down. So it there is a protocol for the doctors to know when to call us. Obviously, calling for when the patient wants to go home is not a static call.
Yeah.
But when there's emergency, someone has a heart attack, or they're almost in a tamponade or have fluid around the heart, yeah, you have to go and check that out. So yeah, we kind of communicate that with doctors too, and they let us know. And it's usually the fellows too that we check and let us know, hey, I tried to scan, but
Mhm.
we need,
They
the
need
official.
the expert.
We need the expert.
Yeah. That's awesome.
That's so cool. So let's backtrack a bit. Like, so when you were looking at your school and your program, why did you choose to be a cardiac sonographer? Like, why not another specialty?
So when I was in nursing school, I wanted to work in cardiology. I think it's just because of my family history has like some type of heart problems. My one grandfather passed away from heart attack, I think 16 years ago. And then kind of after that, it was just kind of thinking, oh, yeah, the heart would be a good organ because it's beating all the time. It's a major organ. And that's probably how I chose echo. I don't think I considered other modalities.
Mhm.
Right now, I'm getting interested more in like vascular too because they're connected. And then maybe pediatric echo because I did scan a few pediatric ones too. They're just cute. That's probably like, I'll say in the future.
Yeah.
But yeah, because cardiology was
That's cool.
my main interest always.
Right. That's
So
good.
That's
I
awesome.
like that. And you still have so many years ahead of you, and you still have so much stuff you can learn. And like you said, you can do pediatric echo and you can do vascular. And a lot of people, students wise, they ask me like, "Oh, I want to choose cardiac, but then like I want to choose vascular. Like, what do I do?" Or they're like, "I want to do general, but then I also want to do cardiac. What do I do?" And I think that your approach to everything is really cool because you did the certificate program, you already had your history of other things. And so I always tell them, like, you can end up doing all of them, it's really up
that's
to you.
true.
Mhm.
That's really up to you. I I thought I went to observe, and I walked around because our clinic back in the day when I used to work at, they had a cardiac general, and I can't remember if they had vascular. But I went from tech to tech and I asked about what did they look like? What do you do? How do you scan? What do you scan? The cardiac for some reason just appeared better to me.
Mhm.
I don't know, maybe because we had a connection with the cardiology in our little pod because our floor was cardiology, ophthalmology, neurology, and all that combined. And
Mm.
we were friends too
Yeah.
outside. So maybe that's why. And I've heard nice stories, crazy stories, and everything in between. And so it appeared to me that, oh yeah, it's going to be a great career. But sometimes I do get questions from people who are just applying to school or they are in school, asking which modality is better. Well, they're all great. There's no better or worse, or one is, I don't know, just sounds like it's better. It's just depends on the interest. You know, if someone likes to do OB, go and observe, see if you like it. Because I would say without seeing what it actually is like, you can't technically decide what you want. So just, I would say, observe. And the program that I applied to, they required 4 hours of observation of the specific track that you wanted, because we applied to either track. It was either vascular or general or cardiac. And I was, I think, the only student from Illinois. I had classmates from all over the place, and I remember we created a group with 3 girls from Colorado on Facebook, and we would message each other about homework, tests, how do you study, kind of explaining things, because if one didn't understand, the other would understand, and would just keep typing. We would create notes for each other. So each and every one of us would do our own notes, but then we would share them with everyone else. I mean, among ourselves, the 4 of us. And I would just stress out to every student, if you're in school, get a study group, study together, because that's how you learn from each other. Because one person will understand one aspect that you don't understand, you understand something that they don't understand. You know, so then you can fill in the gaps. So that was great. We actually, I'll say most of us graduated and passed. And unfortunately, it was during the pandemic, because it was 2020. And we planned on going to Topeka, Kansas. That's where the school is located, to do the graduation. But it was postponed to later. And then some people got pregnant and they couldn't travel anymore. So we said, oh, okay, life happens, you know, but we're planning on actually meeting in person, because it would be nice to, you know, meet in person, but we never did. We're still friends. We sometimes talk.
That's cool though. I'm glad that you made, you know, close friendships with your cohort, and I'm really happy for you and glad that you know, found something that you really like, especially knowing your background history with medical, and now you're here, and you of all people know that there's so much room for medicine, going into one field or the other. You still have so much more growth ahead of you, and we're definitely excited for you, and we thank you so much for being on the podcast and sharing your tips and advice. If anybody was to want to ask you questions, because I feel like they would and will, I actually don't know that many cardiac sonographers on YouTube or Instagram, and you're probably one of the few. I'm sure you know more than I do, but could they reach out to you in any way?
Sure, they can definitely reach out to me. If they're on Instagram, and let me think, my name is Evelyn _in_ Echo Lab. So
yes, that's correct.
Awesome.
Thank you.
We'll definitely
always try.
We'll definitely put that in the description box. But I find it a lot of the times I don't know who to send them to. Obviously I send them to Lynn, but also we would love to have you know, someone who's been in the field for a while. And you definitely have a lot of great insight, and I think great advice. Great stories and things that I think everyone, even students, even future, you know, people who've been in the field already, I think they'll take a lot away from this episode. So we appreciate it.
I hope so. I remember in school it's like a last thought. We told each other to push through. You just have to push through. If you have a bad day, go to the corner, cry, eat ice cream, and keep on going. Because, you know, eventually you'll be able to go through school, graduate, take the test, and if you have to repeat it, you repeat it. I mean, I will admit that I took echo twice because the first time was really tough and I was in a bad situation. So I took it the second time and it was just flying colors. I would say physics was easier for me for some reason.
That's okay. It happens.
So
That's very
it
interesting
happens.
because everyone I talked to said that the echo registry is so easy. And I'm like,
I don't know. I've heard that too.
very
and I was
skeptical.
but I would just take it with a grain of salt.
Definitely.
But study for it. There is a lot of resources out there, and some people say to focus on one resource. Some people say to focus on a couple. I've had on my notes, all my books with me to pass the registry, and I studied from I think it was Ultrasound Registry Review online, and the questions were top notch. Like they were really good and pretty tough too. And I feel like maybe because we study so hard and we go through those hard questions that prepare us for the test will feel a little bit easier because you'll see the question, you're like, oh yeah, I know the answer already.
Mm-hmm.
So maybe that's why some people will say, but I wouldn't say it's that easy.
Thank you so much. Lynn, did you have any last minute things you wanted to ask her? We pretty much.
I do not, because you covered everything. So thank you so
Thank
much
you.
for your time. I know you worked a lot recently, your 8 days. So thank you so much. We greatly appreciate hopping on here and giving us your insights and advices.
Yes.
Perfect. Thank you so much for having me. I listen to you guys every day on my way home. So great.
Thank you so much. We appreciate it. And we definitely will hope to have you on in the future and see how everything goes.
Perfect. Thank you. Thank
Thank
you
you
again.
so much. It was nice talking to you. And we hope
Likewise.
you have a really good rest of your week.
Thank you too. You too.
Thank you.
Thank you. Bye.
Bye. Have a good day.
Have a good day.